Hey guys, my name is Garrett. I'm 51 years old. I'm a registered nurse and I've been in practice for 30 years. I was able to work 25 of them, and within the last 5 years, I became disabled. This is going to be an introductory video so I can tell you who I am, how I know what I know, and then hopefully afterwards you're going to watch the rest of my videos and you're going to become familiar with me so that I can help you on your journey, whichever it may be. Um, I got a really long medical history. My knowledge base is, and I don't mean to come across cocky. I know the name Nurse Know It All. I was just being funny with that, but really, I was trying to get across, and hopefully, after you're watching my videos, you're going to see and hear that I know what I'm talking about because, like I said, I've been doing this for about 30 years. I've got this innate ability God gave me to read and understand everything I'm reading. Now, if you ask me to make you a website or fix something on your car, I could probably fix something on your car, but I definitely could not build a website. I could fix something on your car if I watched maybe a YouTube video on how to do such a thing. But I do have extensive knowledge when it comes to medicine, and I'm going to tell you even further than that. I'm going to take one step more and say I probably know about, well, I won't give you the number, but much, much more than your primary care physician and even some specialists, depending on what the specialty would be, just based off of my experience, off of patients I've treated, um, and so off of my own experience, patients I've treated, and then at the end of the day, when I would come home and research something that I just didn't understand, never saw before, that was many, many years ago. So I like to compare it to like the English language or speaking another language. Once you know it, you kind of know the language, but then as new phrases and what have you come along, then for me anyway, maybe not you guys, but for me, I understand what I'm reading. And so anyway, let me give you a little bit about my history, and then you'll understand maybe why I know what I know. But I started out with neurological Lyme disease. It started about a month after my brother passed away at age of 36, and so we were just 2 years apart. I was only 34, I believe, at the time. A month after he passed away, my stress levels were so high, and I just became ill. And after researching my symptoms online, my symptoms were consistent with someone or other people that had neurological Lyme disease. And I had not been bitten by a tick. It was the middle of winter. I mean, there were deer out there, but certainly not anything like compared to the summertime. My blood testing was what they call indecisive, which basically means they saw something, but they couldn't give me exact confirmation. But again, I had a million symptoms, and they were all consistent with people that were telling that they had Lyme disease. So ultimately, I wound up with a PICC line or two PICC lines in my arm. Over the course of 4 years, I was on a slew of IV antibiotics, and this catheter in my arm is not this little one that stops at the bend of your elbow, but it's one that travels all the way up the arm, way back behind the collarbone into a blood vessel that sits right above the heart, a great blood vessel called the superior vena cava. And so the drugs would go right straight to the heart rather than through the venous system. So I avoided problems like infiltrates and phlebitis. And if you don't know those, I suggest you just look them up if you're interested. But basically, the drugs were very vesicant or toxic to the veins, and so I avoided all those problems by getting the central line put in, being the PICC line, which stands for peripheral inserted central catheter. Shortly thereafter, I beat the Lyme disease, and next thing that happened to me was I started getting chest pain, really, really bad. Now I had a general anxiety disorder, and that was known to many doctors because I had made many emergency room visits prior to that. So people assumed I was just having anxiety. I swore to God up to the cardiologist, you better take me upstairs and do a heart catheterization on me because it was I was losing my breath so bad and the pain in my chest. I said, if you don't do this, I'm gonna die, you know. And So he was just looking at me like maybe I needed a Xanax or something to calm me down. But ultimately, they took me upstairs. I was 95% occluded. My blood vessel was almost completely shut off. Wound up getting a heart stent, and which that is a coiled spring that when released, it smushes the plaque up against the artery wall and allows you to the blood to flow properly, and ultimately you're breathing good again and chest pain's gone, that kind of thing. And so I survived that, thank God. Later down the road after that, I started having more neurological problems. Not they were actually similar to what I had with the Lyme disease, but they were different. And so I went to a neurosurgeon by the name of Fraser Henderson, who did a lumbar puncture on me. He's in Silver Spring, Maryland. Supposedly was a very good neurosurgeon. And he did a lumbar puncture on me, and my number was way, way, way above normal. And that was indicative of the high pressure of the cerebral spinal fluid inside my brain. Um, and so the established normal values are way, way lower than what my numbers were. And so it was determined that I need to get a shunt, or it's a catheter that goes in the brain. I got two of them because one of them failed, and the other one, it was going down the front of my chest wall, sits in an area below in my abdomen called the greater omentum, which is basically underneath the fat layers in the stomach. And so the fluid drains out of my brain, equalizes the pressure, and drains down into my bladder. Well, that didn't go so well either because the surgeon cut my bowel when tunneling the catheter down into that area. Subsequently, he pulled my parents out in the hallway, said this had never happened before. It was a rare occurrence, and ultimately I had a drain I had to walk around with in my stomach, and now I'm left with a big old scar. Not the end of the world. So I continued to use them, and I'll get into the problems I had with him following that in a moment. Um, but then the next thing that happened was I started having even more neurological problems that were way different than the other problems I was having. And um, that was associated with blurred vision. And I won't go into all the symptoms, but I had plenty of symptoms. So I went to Johns Hopkins and I had an MRI, multiple MRIs over a couple years. And I was told basically what they do is they use the little wheel, this little guy here, of a mouse, so that when you have an MRI, they take hundreds and hundreds of images, and sometimes even thousands, and they stitch them together, and it plays like a movie that the neurology doctor will look at, and they use that little wheel and the mouse to watch the movie. I'm calling it a movie. It's not really a movie, but it stitches the images together, and they can look at it in about 2 minutes and tell you, oh, everything's fine, looks fine. You need a psychiatrist. You're probably just depressed, what have you. So I took the disc home and I put it in my home computer and I studied for a while because they don't teach us in nursing school how to read radiological studies. And so I learned how to read MRI scans over a course of time. And then I put the disc in my home computer and I just watched every image, not that little movie thing with the wheel mouse. I looked at each individual picture and literally hundreds and hundreds of pictures. So in doing so, I noticed a picture that just didn't look right, and I'm going to post them for you down the road, or maybe in this video. I'm not really good technology wise with working the computer, but I have a friend who is, and maybe he's going to help me with that, and I may include them at a later date. But basically, the artery in my brain was what they call dilochoectasia, which basically means a big fat artery. It was almost aneuritic, but it was actually normal anatomy. It was just a little bit large, and it was pushing on my brainstem every time my heart beat. So I developed what they call a brainstem shift. So it's normally supposed to be up and down in the spine, but in my case, the artery was pushing on the brainstem, and so my brainstem was kind of like tilted like this, and that was the cause of my neurological symptoms. I actually contacted a doctor in Arizona at the Barrow Neurological Center. His name was Dr. Spetzler. Everybody, anybody, and everybody who's graduated a neurology program from any medical school around the country knows this man. He's like considered to be God um, in the field of neurology or neurovascular surgery. I don't know that I'd go as far as calling him God, but and I'm not a religious person, but he's probably the best doctor in the country. And I emailed him the photo, and he wrote me back and said, "Oh my God, that's a magnificent find. I don't know how you found it, but you did, and it's less than 5% chance of a complication. If you can get out to Arizona, I'm going to fix you." And that's exactly what I did. So over the next month, I made plans to do so. I flew out there, was in the ICU for about a week after the surgery, and came home and took about 6 months, and most of my symptoms reversed, not all of them. Then I had another condition from the Lyme disease. I got to back up here because I forgot to tell you this one, but it's a major symptom I walk around with today. It's a permanent symptom, but it's no more infectious, at least. But it's called POTS, P-O-T-S, which stands for postural orthostatic tachycardia syndrome. Basically, what happened back then, and it still happens today, but it's nowhere near as bad, and I can live a normal life with it. But basically, what happens is when you stand up out of a chair, you don't have to do any kind of exercise whatsoever, but just the mere action of standing up, the body recognizes that you're not sitting, and it makes my heart race. And I'm not talking just a little bit. My numbers were going from like 80 beats per minute to like 190 just standing up out of a chair. And today it's kind of like all over the place because I'm trying to come off a medicine right now that's very, very tough called Xanax. Supposedly it's like tougher than coming off of heroin, is what I'm told, and it's the hardest drug to come off of that's out there in the pharmaceutical industry. So of course I'm on it because I get everything, right? But I've been on it since I was 18 years old, and I'm 51 now. It just started causing me trouble um, within the last year or two, and I just don't want to deal with it anymore. So I'd rather just come off it, and I will not be on any medications. But the last thing that really happened to me was I went back to this doctor because my neck was killing me, the one that cut my stomach and cut my bowel, and I had to walk around with that drain in there. I went back to him because, like I said, he's supposed to be really, really good, and he was close by to where I live because I'm in Maryland, and he was in Silver Spring, Maryland, and so it wasn't that far for me to travel. And I had a herniated disc in my neck, and the chance of complications with that surgery was less than 1%. And it was an outpatient procedure, and I was supposed to go have it done, and it was going to take about an hour, and then I would come home, and within the next 24 hours I should have been fine and pain free, or pretty much pain free. But what happened was, when I was on the operating table, and he never even called me to say, "How you doing? I'm so sorry, blah, blah, blah." I never even heard from him, not one time after he gave me a stroke. He cut my carotid artery when he sliced open the back of my neck. Don't ask me how that happened. I have no idea, but I did read the operative report, and it confirmed that he did cut the carotid artery. I assume it was an accident. That's what he would say, probably. But in order to stop the bleeding so I didn't bleed to death and die on the table, they sprayed it with this drug called thrombin. And thrombin is a blood clotting agent. And so it stopped the bleeding almost immediately, I'm sure. And some of it got into the blood vessel itself. And so I developed a blood clot inside my carotid artery on the left one. And what happened was I came home, and so this less than 1% chance of anything going bad happened to me. And that blood clot broke off and traveled up to my brain, gave me a massive stroke. I was paralyzed. I was in a nursing home for several months. I had to learn how to walk all over again. And it paid off, the hard work, because today I'm back in the gym. I'm like one of the strongest guys in the gym. I can squat over 1,000 pounds, and all the other weights I lift I can do in pretty good weights compared to other people. So and there's more. I'm not going to go through every little surgery I've had, but those are the major ones that I had. And I tell you, I'm not a religious person, but I'm probably about to be, because have got to be all science. This does not just happen to one person. And again, now I'm currently dealing with this coming off the Xanax, and that is by far probably worse than anything I told you in my medical history. And not to mention, they had me on about 15 different medications following the stroke, and I was a little bit overweight. So over the last 3 years, what I've done is I've not only have gone back to the gym, but I've been eating right. I cut out all bread, all pasta, low carbs, and I dropped about 80 pounds. And today, I'm happy to say I'm probably in the best shape of my life. I mean, I was a Maryland State wrestling champion when I was young, so that kind of gave me the, mm, to go after it and get better. No matter what is thrown at me, I can beat anything, and you can too. It's all about attitude. And I just had a wrestling coach that built me strong. When I lost a match, it was only because of me. I couldn't blame 12 other players on the team or five or whatever. Like in basketball, if you lose, you could say, well, Shaquille O'Neal didn't pass the ball to me or whatever. When I lost a wrestling match, it was because of me and me only and nobody else. So that's kind of how I go through life. And I don't rely on anybody. I just take care of what I got to take care of. But that's a little motivational piece for this video, and I strongly suggest that you implement that in your life, because if you're watching this, chances are you got something medically wrong with you, and a lot of times it's all, in the brain. Thank God mine is still working, but I can't tell you, stress is probably how all this even started with me in the first place, because when I lost my brother, he was my best friend in the whole entire world. He was young, he was only 36 years old. Um, and shout out to him and his grave, Stephen Engelman. Love you, miss you. I'll be with you again one day. But for right now, I'm here to help you guys. So anything I can do for you guys to help you along your journey and whatever it is you're dealing with, feel free to drop me an email. And if I don't know the answer, I will research it and I will find out the answer and get it back to you. I mean, that's just the person I am. I'm not in this for any kind of money. However, I am going to be probably at some point putting up a website, because the Xanax, that, oh my God, the anxiety that comes with that, it's like nonstop and it's all day, along with all the neurological symptoms. Again, I got something that gives me neurological symptoms, trying to wean off it and come off it. But what I've done is I've identified products out there that are good for the anxiety and good to come off. I'm not talking about pills or anything you swallow supplemental wise. These are going to be all, I guess you could call them medical devices, or things you can do. Some of them are devices. Some is just simple meditation. I mean, breathing exercises and things like that. And I will share them with you in future videos, that I guarantee and promise you. But I got into a bankruptcy. I was losing my house. I went into foreclosure, and now they're looking to repossess my car. So, I got this knowledge. If I can make a couple dollars and try and get out of some of the debt, it would be really, really nice if anybody wants to help out with some of that. But in return, I'll turn you on to these um, devices and things you can do to help your anxiety. I won't charge anybody to talk with, just information from me to you to help you along in your journey. But, with the anxiety, that is such a bad disease. And I've spent so much time researching and trying different things. And while I'm on the topic, let me just talk about one last thing, and then I'm going to end. And hopefully you're going to stick on my channel and subscribe and watch all the rest of my videos and get very knowledgeable. I don't care what your degree's in, you will understand me, because I understand everything I read, and I will describe it to you in plain English. The first video I'm going to do is on antidepressants, specifically the SSRIs, selective serotonin reuptake inhibitors, and the selective norepinephrine reuptake inhibitors, which are the SNRIs, the MAO inhibitors, which was the older medications that were used to do the same thing, and finally the tricyclic antidepressants. So I'm going to make a video on antidepressants, and I've researched the heck out of those. I know I'm talking about my friend in New York. His name is David. He's a doctor, and he has an anxiety disorder. Also, we met on the internet, and he's right up there understanding things like I do. So we talk frequently on the phone. When I don't understand something, I go to him, and vice versa. And in the end, usually we can figure stuff out. And sometimes we can't figure stuff out because medicine thinks they've got it figured out, but when you go to the literature, it says it's not completely understood, or it's not well understood, or the exact mechanism of action is not well understood, but yet the doctors want to give you the pill and say, take it, it's going to do this, that, and the other, when in fact the literature says just the opposite. So do your own due diligence. Listen to me for education, because that's what I'm here for. We can't prescribe, we can't diagnose, but we can certainly educate you. And that's really the only thing that sets me apart from a medical doctor, um, with the exception that I just know more than they do. I didn't even go to medical school. But, think about it. If you go to medical school and you have an instructor and he's going to teach you this, that, and the other, when you come out of medical school, that's all you're going to know is this, that, and the other, unless you go to the computer or you're dealing with patients specifically and you have an alternate form to learn the information and then make sense of it in your head. So that's what I've done. That's what I'm here to do, and I'm here to help you. So again, my name is Garrett. I'm 51 years old. I live in Maryland, and I've been in this field for 30 years, and I've only been able to work 25 because of my stroke. But I'm just about running again, and that's just from pure determination and pushing forward. And I suggest you do the same. So God bless. I'll talk to y'all soon. Be well. Good to meet you.